Hi class, I am Marianne Scalise and I will be teaching this week. We're going to be going over pulmonary alterations. Pulmonary alterations have to do with our lungs. Our lungs are a pair of large spongy organs optimized for gas exchange between our blood and the air. If the surface of our lungs were stretched out flat, they would occupy an area around 80 to 100 square meters. That is about the size of half of a tennis court. Wow, who knew that? Lungs give us ability to sing, to laugh, to speak, and cry. This week in class, we're going to discuss pulmonary alterations. When looking at our normal lungs here, we have the trachea, branches out into the bronchi, right and left, and then it branches right down to bronchioles, and then to alveoli. There is 300 million alveoli in your lungs to release the carbon dioxide in the air when you are breathing out. During a normal day, a person breathes more than 25,000 times. But with lung disease, people have difficulty breathing, and lung disease encompasses millions of people in the U.S. Lung disease is the third leading cause of death in the United States. It is responsible for 1 in 7 deaths. In this class, we are going to discuss pulmonary disorders. These are when people can have abnormal lung function. They're categorized into a lot of different groups. Restrictive lung diseases, obstructive, respiratory, pulmonary, respiratory tract malignancies. Restrictive lung diseases, you look down here, are reduction in lung volume. There's decreased compliance of lung tissue. Therefore, it results in increased work of breathing. It usually affects the alveolar capillary membrane, causing a decreased diffusion of oxygen from the alveoli into the blood, resulting in hypoxemia. Different examples are pulmonary fibrosis, excessive amount of fibrous and connective tissue, acute respiratory distress syndrome, ARDS. That's when you have a terrible respiratory failure due to this capillary membrane, and the alveoli have a lot of damage. We're going to review obstructive lung diseases. There's a reduction in airflow. Some of these diseases you may be familiar with. You may know somebody with them or even maybe experienced them yourself. This is when someone cannot breathe the air out of their lungs. It's like when they take a breath, it's like as if they're breathing used air. Then there's no room to fit new air, so the air gets trapped. Some of these examples are COPD, asthma, chronic bronchitis, emphysema. Here we've got the emphysema, bronchitis, where there's a lot of narrowing from inflammation. It's kind of like, you can think of it as when you get a mosquito bite. You have inflammation, redness, swelling. The same thing happens in the inside of your lung lining. And then you've got mucus production, making it very difficult to get the air out. Another group that we're going to discuss is respiratory tract infections, such as pneumonia, which is acute infection of the lungs, either by bacteria, viruses, fungus, or parasites. We're going to discuss tuberculosis. When you're in the hospital working, you'll get tested for tuberculosis every year. It is transmitted by airborne droplets. Another, we'll be discussing SARS. SARS is a severe pneumonia that originally began in China back in 2002 and affected people all over the world. And with all the traveling people are doing and all the people crossing over the borders, we definitely may see an increase in SARS. Another discussion will be on pulmonary vascular disease. Those disorders are like pulmonary embolus, pulmonary hypertension, or core pulmonale. Cor pulmonale affects your right side of your heart, your right ventricle. Lastly, we'll be discussing respiratory tract malignancies, which are such as lung cancers. So, what do we do? How do we find out? How do we diagnose and test these diseases? Well, different things we use are chest x-rays. Takes imaging test of your lungs, a picture, can look at the structures and organs in your chest. CT, which is computed tomography. It's a scan that takes many pictures. It does it in slices, so it really can take a look at blood vessels, bones, muscles, fat in your chest, everything. Magnetic resonance imaging, another way of taking pictures. We have biopsies where we take a little piece of lung tissue and look at it, especially used in diagnosing different cancers. Bronchoscopy, that's when a thin tube is put down into your bronchi and they take a look at how the tubules look. Pulmonary function tests look at how well your lungs are working, how deep of a breath you can take, how much air you can blow out. Peak flow measurements measures the air flowing out of your lungs. That falls under that. Chest ultrasound, imaging tests with sound waves to look at the structures of your lungs. So those are just some of our tests and diagnosis that we do to diagnose lung disease. Signs and symptoms, we'll take a look at all these different diseases and what they often see. Usually shortness of breath. They can't catch their breath. Think about how scary it would be if you couldn't take a breath. Has anybody ever experienced hyperventilating? Or you ever got the wind knocked out of you? Very scary, right? These patients experience wheezing and tachypnea and persistent coughing, cyanosis. How do we treat them? What kind of nursing care are we going to do in the hospital or community setting? What kind of education are they going to need? First off, one of the top priorities of education is cessation of smoking. We know it's difficult to talk to patients about this, but it is necessary. They need to stop smoking. What else? Avoiding allergens for these asthmatic patients. For chronic bronchitis. Think of these diseases as a lot of narrowing. So they're going to experience a lot of tightness in their chest. So teaching them proper use of inhalers. When is it important to use oxygen? Importance of exercise and good nutrition and hydration. Attending pulmonary rehab. Most of all, we want to show our support for these patients, leading them to support groups such as the Pulmonary Fibrosis Foundation or Better Breathers Club. American Lung Association has support groups. It is so important to support and care for these patients because breathing is essential. Looking forward to learning with all of you in class this week. Have a good night.